This is the Forbes Books Podcast, conversations with remarkable folks who are impacting the world of business and beyond. Hola, I'm Joe Pardavila, and for much of my adult life, people have said I have a face for radio, and maybe they're right, and possibly my guest this week can give me a hand. His name is Dr. Dennis Schimpf. As the founder of the esteemed Sweetgrass Plastic Surgery, he and his team perform thousands of reconstructive and cosmetic procedures each year, helping patients restore confidence and transform their lives. Dr. Schimpf is also an accomplished author and speaker. He wrote the acclaimed book, Finding Beauty, Become a Better You Through Plastic Surgery, sharing the wisdom and insights on using plastic surgery to reveal one's inner beauty. Doc, how are you today?
Good, Joe. How you doing today?
Pretty fantastic. And so I want to start this conversation by talking about your sort of journey through medicine, because I always find it fascinating, because there's so many fields of medicine, how you find yourself into one thing. So plastics. I know the famous line in The Graduate was the future's plastic, but why plastic surgery? How did you end up in that space?
Well, I really came to medicine through a non-traditional route. I was about 4 months away from graduating from college. I was going to go to law school, actually, and do a graduate degree. And because I had neglected to do my community service that I needed to, volunteer hours, I had like a couple hundred hours I had to do in the program I was in to graduate. And my counselor was like, the only way you're going to get that done before May, and of course this was like January, is to go somewhere that's open 24 hours a day. And so I ended up going to a local small emergency room, started volunteering in there, just, cleaning up, pushing patients around, kind of just hanging out. And I loved it. I absolutely loved it. And I did, that for those couple months. And at the end of it, I just decided I was going to try to go to medical school. And I had never gone and done any of the sciences. So I had to spend the next year and a half taking one semester. I remember I took chemistry, anatomy, physics, and something else. And it was just, hard, but I did the best I'd ever done in school. And so, I spent that year and a half and ended up doing a little bit of graduate work in neuroscience while I was doing it, and ended up in medical school. And then I knew I wanted to do something like hands-on, and surgery was just something I always was kind of fascinated with. And originally, I thought I was going to do neurosurgery, but ended up going the general surgery route. And at the end of general surgery, you either go practice general or you specialize. And I loved plastic surgery because it was the one specialty that you still operated on the whole body and wasn't really tied to one area. So, plastic surgery includes cancer reconstruction, surgery on children, cleft lip and palates, burns, microsurgery, and then, of course, the thing everyone knows is aesthetics and cosmetic. But it's really a small part of the overall training. I did 5 years of general surgery, then 2 years of plastic surgery fellowship, and been in practice now, about 15 years or so.
There's not many doctors I speak to who say they became doctors because they partied too much in college. Was that essentially why you were having such a good time that you forgot about all the other things you needed to do? It's like the sliding doors thing. Like if you concentrated in school, Dennis, who knows what you would have done?
Joe, I'm not sure that's exactly what I said, but that may have been the message. I went to school on an athletic scholarship. I definitely was not school focused the whole time, and I was very fortunate to go the path that I went, and actually went back to school, after graduating to do a graduate or MBA degree. So I got better with schooling as I went along. I realized the importance of it more as time went on.
That's good. And you know what's funny? So you and I are probably old enough to sort of recognize this sort of societal feeling towards plastic surgery, because when I was a kid, I guess we're around the same age, maybe Gen Xers, but when we were younger, it was sort of like, oh, look at the work they got done. And now it's like, oh, look at the work they got done. So it's funny how that in terms of just, it's not even just like the actual I'm sure the surgery has evolved since you started and such, but like the attitudes towards it have evolved, where it's not so much like when I was talking, like that sort of like tone of like, oh my God, look what they've done. When did you start to realize that this was sort of becoming more and more acceptable and not just being like a rich person thing to do?
Right. I think a couple things have happened. Not only that, I think the patients themselves have become more comfortable with it and more almost proud of having some of it done. And I think the effect it's having on them, feeling more confident, they're wearing, different clothing, different bathing suits. So I think that progression has come with social media and the media in general, I think, I hate to say it, but things like the Kardashians have brought to the forefront different types of cosmetic surgery. I think Hollywood and that whole world has probably evolved from, like you said, it was hush hush and nobody wanted you to know, to it's okay, and it's okay to do something. And I always find it interesting because almost in every other facet of our life, we'll try to do things to better our situation. You go out and try to get nice clothes, you try to get a nice haircut, women try to get nice makeup, they're getting their hair done, their nails done out in the open without a problem. Nobody goes into the store and says, give me the ugliest clothes that you have and I want to look bad. Even the house, that you live in, you decorate it to look nice, you buy a car that you like. It's kind of weird that then with the most personal thing, we had to be shy about it or not seem like it mattered. And I think not only does it matter, it matters to men just as much as women, if not more. And I think it's becoming more acceptable, maybe because people are more knowledgeable through social media. Not all that knowledge is accurate, but I think people are more aware of what's out there, what can be done, and the effects it can have. And everyone has something that they don't like about themselves, and nobody else can tell you it's not real or it's not reasonable. If it bothers you and it's something that safely and easily can be fixed and it changes your quality of life, I think you really have to consider it.
And one of the things you mentioned, media, and I think, again, going back to our early days, the idea of plastic surgery was sort of sensationalized by the Michael Jacksons of the world. And even in New York, growing up was, I'm sure you remember the story of Jocelyn Whittlestein, the cat lady, because she ended up looking like a cat. And now when you see plastic surgery, it's like, damn, who they use for that? So there has been, I don't know if like PR, your industry got a better PR representation or things have improved, but I feel like nowadays we're not seeing those sort of, plastic surgery nightmares that were so prevalent in like the early 80s and 90s.
Yeah, I think actually what's probably happening is we're getting a better representation of all of the plastic surgery because people can, with a phone, post things that they're experiencing, which are more normal. If you go back in time, the only things that were out there hitting the media were just sensationalized things that were attention grabbing in the media. 99.9% of our patients don't want to look overdone or like they had something done. Now that's different on the West Coast and some New York and Miami and some of these areas. It's a status symbol for some of these folks, so they do go over the top and get overdone because probably their perception is a little off compared to the average person. But also it's a status symbol. If you can afford to spend tens of thousands of dollars, and people kind of want, certain people anyway, want everyone to know they did that. The biggest concern we hear from folks is I don't want to look overdone. I don't want to look like Kenny Rogers or people like that. And, really it's not the rich that really supports our industry overall. There's just honestly not enough rich people to do that. It's, it's the hardworking double income families where, the wife has had kids and her goal is not to be on the cover of Cosmo. Her goal is to get back to how she was in her 20s or 30s, or at least pre-children, as close as she can. Their expectations and goals are to fit better in a dress and bathing suit and to, feel more comfortable about themselves. And so I think those are really the ideal patients that we look for and the ones that are truly the most sort of satisfied in the end.
And you talked about the sort of cosmetic surgery industries in New York and Los Angeles and Miami. You practice in the low country of South Carolina, Charleston, Mount Pleasant area. Is there any difference between like you and a doctor in New York or is it geography? I mean, are you doing anything differently? Are they doing anything differently than you're doing day to day?
No, I would say there's a difference in the patient for sure, in what their expectation and what their goals are for sure. The techniques that are being used, the surgeries that are being done are absolutely no different. And we have access to, the latest and greatest, as well as stuff that's been proven through time. And I think a lot of it, like so much, like so many things, is advertising, marketing, and what they're selling is a concept, not really a different procedure. And I think you hear that a lot, like with vodka, right? Like vodka, they say there's not much difference in the highest versus the lowest, but a lot of it is marketing, what the bottle looks like, how, like Nike and these different companies, they sell not a product, they sell an experience or a feeling. And I think that's an important part of plastic surgery. I think how it makes you feel is what's ultimately important. And, there are a lot of folks that come in with a nose and say, I can't live with this. And I look at it and I'm like, I think your nose looks great. Like, but to them, they don't. And so, it's how they feel when they see themselves. And no one is is a worse critic than yourself when you're really evaluating yourself. And so I think our job is really to ride that line of what's reasonable, what's achievable, what's safe. There are people that we have to just say, I don't think we can make this better. And then you're going to have a scar and you're not going to be happy. And so I think that's one of the things in residency and surgery residency, even general surgery before plastics, that's a big concept to learn when you're in training. Is it's easy to know who to operate on. It's really harder and more difficult to know who not to operate on and when not to operate.
And one of the things you don't learn when you're in medical school is being an entrepreneur. This is something I've talked about to many doctors who are like, when they're going to medical school, they're busy learning to be doctors. They're not busy learning how to run a practice or be an entrepreneur. Obviously, you went back and got more education. But talk to me about that in terms of plastics, because I feel like of all of the sort of verticals in medicine, I feel like plastics is probably the most entrepreneurial, and just from the surface for me, because I don't see a lot of advertisements for a general practitioner or an OBGYN, but you do see that for cosmetic surgeons. I mean, maybe you can weigh it a little bit in terms of like what it's like to become a doctor without even learning the business side of things. I mean, obviously, like you said, you went back and did it, but talk to me about that sort of transition from being doctor entrepreneur.
Yeah, it's a huge transition. And it's one, I think, it really goes back to the system that we're trained in and educated in. And those are usually academic centers. And so an academic center is not a well-run business by any means. Its purpose is not for profit or to be efficient. It's usually to train, residents, medical students, nurses, and it's there to serve a purpose for the general community. A lot of times, folks who can't afford healthcare, and so it is nothing like running a business. And there are so many levels of bureaucracy and redundancy in a lot of those institutions, and a lot of those doctors are really just hired and paid for a service, and they're not really incentivized necessarily, and they're not really rewarded for doing a better job. Unfortunately, I think there is a push towards that now, but 20 years ago that certainly wasn't the case. So you have all these folks coming out who are in training and who spend several years concentrating on medicine, and if you do go into private practice, and I worked 5 years in academics and now about 10 years in private practice, it's a big difference. It's a huge difference. There's a lot of advantages and there are a lot of challenges that are different. But I think what you really have to remember from our approach is that we're selling a service or a commodity. Whether you're selling a steak or you're selling a car, sure, surgery is different, and I know I'm not equating the two, but at the end of the day, a person's coming in paying for something, and we need to deliver. We need to set expectations and make sure we deliver to those expectations, and we need to stand behind what we do. And it's a little different than the mentality of a lot of medical folks. And I think that's one thing. You're selling a service. And number two, it takes advertising. And so that's something that most doctors don't have an experience with. And most medical fields, like you said, don't go advertising, although you're starting to see some of it with things that are becoming more cash for service. It's hard to advertise if you're 100% accepting insurance, because ultimately your patient population's dictated by who's in network and who can come see you. But when you're going out and getting a medical service or aesthetic cosmetic service that you're paying for, you have freedom and choice of who you see, and that's where marketing and reputations and branding, especially branding. I'm a huge fan of branding and believe in it tremendously, and I think that's a big part of it.
I want to get into your branding part of it. One more thing on this, and I don't want to get too deep in the weeds of this, but talking about becoming a doctor/entrepreneur, getting into the weeds of like running an office, bookkeeping, like how did you learn all of that? Because again, they don't teach that at medical school. Like how did you go about doing that and making sure that you were running a tight ship and that you were surrounded by people who know what they were doing, because I can imagine that can't always be the easiest thing to do as a physician.
Yeah, no, it's not. I think you try to surround yourself with the right people, and you never know, whether or not that's the case necessarily, because you don't know better. And I think also, if you're fortunate enough to grow, that environment changes. And so there are some really good business books written about, getting the right people in the right bus, but also in the right seat. So a lot of times you can have the right people on the right bus, but if they're not in the right seat, then they're not effective. I think a couple things, that I learned is I think you want to have, some really good legal representation advising you, especially early on when you're building a business, so that you put in all the requirements that you just wouldn't know about unless you had a good healthcare based attorney. I think you need a really good accounting company or service. And I think the biggest thing with doctors, and I think in general, we think we can do everything ourselves because, you're kind of going that route through training. And I think the best thing that a young doctor or surgeon can do for themselves is realize their sort of limitations, and that your time's spent much better doing what you've been trained to do. And you have to trust people. You have to outsource bookkeeping, accounting, tax stuff, all of those kind of things to be efficient. And if you want to grow, you have to have that ground level laid in the right way, because it's hard to build on a foundation if it's not right. And it's a lot harder to go back and do that. So I think outsourcing and really getting, the right people in the right place is a very important thing. And, with COVID and the things that have happened, I mean, there's been some struggles with staffing offices and with getting the right employees. And as you know, the employment environment has changed a lot over the last couple of years, especially. So getting the right people in the right place is very important. Our front desk people are so crucial. They answer the phones. They're the first people to say hello to someone when they walk in. A lot of times I don't think they realize just how important they are, because if somebody doesn't get the right feeling at that entry point, we're probably not going to see them, or we're not going to have the chance to make them become a customer or help them become a customer.
And I want to bring up a gripe that's been driving me crazy about the medical industry for the last couple of years is the text automation system that everyone and their mother has signed up for, and the fact that you get 40 text messages and emails confirming your upcoming appointment. Now, I get, for efficiency's sake, they're great, but man, they are so annoying, Doc. Can the people in your industry just like back it off a little bit? I have like a dentist appointment. I got, no joke, like a dozen texts and emails leading up to that appointment. First of all, why do we need so many of those? Is it just because it's the default setting that you folks like sign up for? What's the deal with that?
Yeah, it's funny. We were just talking about that today and trying to devise the best sort of CRM protocol in terms of customer relation management. When do you call people? When do you follow up with them? And how you do that in a way that keeps you at top of mind and hopefully addressing any problems that they have without annoying them. I think a lot of it is the programs that are built today are not necessarily the most efficient. Despite all those messages, we still have people who show up and say, I didn't know, or they'll say they went to the wrong office. So I don't know what the right answer is for that. It's kind of like the social media world. You hear post 2 to 3 times a day or a week, and now people are saying you can't post enough. I mean, so I don't know what that is. It's hard. I think we're trying to balance that with, a touch point or two, and then, at some point you got to leave them to their own devices and try not to upset them. So it's a hard one because, we'll see, I don't know, anywhere between 500 and maybe 700 patients in a week in our multiple offices. And with that, you have a wide variance of the people. And so there are people who don't mind it, people who want that, and people who absolutely hate it. And so unfortunately, it's just so hard to know where that right point is.
I mean, I totally understand the idea behind it. And I think it's obviously, especially since we are all like surgically attached to our phones, it makes perfect sense. But I feel like there needs to be a little more nuance to it. Here's an example. So I had an appointment to go to a oral surgeon, and they had sent me multiple texts and emails reminding me about the appointment. The morning of the appointment, I get an email from the human who works at the office. They're like, hey, just want to remind you about the appointment. And also, don't forget to bring in a CD of your CT scan. I'm like, what? Well, I didn't know anything about that. But I did get 40 messages reminding me of the appointment. So I feel like using all of that, like automation is wonderful, but I still think that it can't be like the Ron Popeil set it and forget it. Like, use it, but make sure, like you said, have that CRM, have a methodology in place where it's not just doing it for the sake of doing it.
Yeah, and I think like you alluded to, I mean, there becomes generational changes, and I would much rather our people call someone and speak to someone, but there are a lot of people who are bothered by that, and today especially, who aren't used to that or don't want that. I read over the weekend, I don't know where I saw it, that something about, you send a text message, but you don't leave a voicemail anymore. I guess, again, depending on who the target is, it's different and it's hard, but I do think it's something that I'm very interested in. I wish we could figure out the right mix of that, of how to do that. But I would rather, talk with somebody, because I think there are a lot of things that come up that aren't being covered. And the other thing with multiple touch points, or if you do that, a huge amount, it also increases the likelihood of like an error because, then people, they get the wrong message, the wrong time, the wrong date, the wrong place. And so at some point it's just, you kind of, you got to set it up, let it go, and see what happens.
All right. Well, we're not going to fix that problem today, Doc.
No,
but
I wish we could.
And so earlier you mentioned about branding, and one of the ways you're building your brand is you wrote a book called Finding the New You. So let's start with the book. Why a book? Of all the things you could have done, because we all see many ways that especially cosmetic surgeons reach out to folks, whether it's with social media, TV ads, direct to consumer. But why was a book important for you, Doc?
I kind of came about it. I didn't set out to write a book. I had kind of been watching some YouTube stuff and some podcasts and those TED Talks. And I had seen one by a gentleman who was a design engineer and talked about, this is actually in the introduction to the book, he talked about beauty and what is beauty. And it kind of made me start thinking, like, it really is difficult to tell somebody else or to understand what somebody else thinks is beauty. And so in our field, it's really interesting and challenging for us to do that. So what I may think looks perfect on somebody, they may not. And what they think's perfect, I'm like, God, we need to fix that. So it's really an interesting thing. I've always liked books. I was kind of as a kid growing up, and even today, I love sitting in bookstores and actually physically holding something, whether it's a magazine or a book, and looking at it. And I still can't get used to reading books on iPads and things like that. It's just not, there's something about the experience. I also like the idea, and I can't say I knew this at the time, but we've used the book as a tool with pre-ops. So when people come in to sign up for surgery, we've started giving them some of these books to take home and to read. And I think that's a huge thing for them to look at and to kind of build their expectations, and also helps them get some of their questions answered, but also generate some questions for us. So it's kind of a tool that we let people take home with them. And so I think that's been extremely helpful. Today I know people do a lot more high-tech things than write books, but we did do an audio version of it. And so I think that's definitely like this podcast and audio has become, obviously much bigger. So, but I kind of am the old, thought where I enjoyed books. I always liked them. I still like stopping at bookstores.
So the book is not a how-to plastic surgery book. So it's not like where you're teaching people. What is the book? Like, how would you describe? Because I flipping through it, I was like, it's like interesting concepts about what is beauty, about appearance, impact on it. So it's not the book you would immediately expect from a cosmetic surgeon. So why did you go this route in terms of like what you were trying to like parse out? What kind of information were you hoping that people, like a young Dr. Dennis Schimpf walking through a bookstore, coming across it? What were you hoping people get out of it?
So I can start by saying what I didn't want to do. And I didn't want to make it be, a walking billboard or advertisement for me or for our practice. So I wanted to do something that was useful across a bigger sort of population. So I really wanted the book to help somebody who was considering plastic surgery with us or with anyone, anywhere else. And I wanted it to be a tool that they could use ahead of time and maybe use as they went through the process. So what we did was basically took concepts that we see on a regular basis from patients, whether it's, post or pre-op questions or, kind of getting their family on board, talking about the healing process after surgery, the long-term process about things. So things that we saw on a regular basis. And I used a patient or two to write each chapter. So each chapter addressed one of these concepts that I thought was repetitive and important enough that somebody would benefit who was considering plastic surgery, who had had plastic surgery, whose family was having, those types of things, that they would get something out of it, that it was an easy book to read, it was quick, and it hit some of the major concepts that come up in that process. And again, I wanted it to be for anyone, and I hope that's the case. I hope somebody in Nebraska who's considering it reads it and gets something out of it.
That's cool. And in the book, you also bust some myths. What are some of the myths of plastic surgery that top mind, or maybe how like the text messages from doctors annoy me? Like, what's one myth that annoys you the most about plastic surgery?
Well, I think the biggest thing that we deal with is, we see somebody ahead of surgery, we talk about a plan, we go through a tremendous amount of information, and, they'll show up at the first visit days later and complain about the outcome at that point. And we literally will tell people this is a 4-month, 8-month, a year. Scars take a year to a year and a half to get better. I don't know how to get that message through to people any better. And then I'll say, we talked about this, and they'll be like, oh yeah, I guess I remember, or they'll tell me they didn't remember, which even amazes me more because they've read it, they've signed things, I've told them. But, I think it gets back to the human concept and probably, evolutionary folks say it's the only way humans get out of bed, is that you sort of don't think it's going to happen to you. So the other thing is complications, right? Like every surgery known to mankind, every medical procedure, there is no 0 complication rate and there's no 100% success rate. So I tell folks that all the time. There are no 0s or 100%. And a complication is no reflection on the person. It's basically, or the surgeon or the patient, it's just a number of at-bats, that there is an end number that something will happen if you do it enough times. And again, I think we as individuals just don't ever think any of that's going to happen to us. So when it does, we're always surprised. And when it does happen to you, it's no longer, a 1% complication rate. It's 100% for you now because you've had it. And so I think that's, we try to educate folks. And I think that's where the book hopefully can help people ahead of time. And we also try to encourage folks, to have patience. And we tell them that ahead of time, because once they're having a problem, they don't believe you. They think you're just telling them that to kind of, shut them up and kind of move on. But if you tell them ahead of time, listen, there is a number of people that will have a wound healing issue, that will have an infection, that will need to have a revision. And that number is real. And it can be significant, that the human body is dynamically different from each individual. And so that's why large studies are done to understand what the most likely outcome or common outcome will be. But, it's a bell curve, and there are people at both sides of it that, don't have an issue. And then there are people that have more issues than average. And there's just not a test that we can do ahead of time to know who that is, unfortunately.
Which surgery takes the most time to recover from? If you were to anecdotally, obviously, without getting into data points, but which do you see that is the one that takes the longest for folks to get back to sort of their quote unquote normal self?
Well, definitely the more invasive stuff we do. So if you do liposuction, it's very, limited and not invasive. It's done through tiny couple millimeter holes. You're sore, but you can go back to normal activity the next day.
Wow.
When we get into, tummy tuck, abdominoplasties, where we're tightening muscle, folks are sore. It hurts. For 5 to 7 days, it really hurts. But, by 2 to 3 weeks, they're up and about, and a lot of non-physical jobs you can get back to. What we're talking about in the several months is really swelling, residual swelling, and final outcome. So skin tightening, skin kind of adjustment, that takes months and months. And scarring, it can take a year and a half, 2 years in certain skin. Folks that have lighter, especially folks who have light skin, light colored eyes, their skin tends to get really red, and they can have scars for, a long time. And it's hard because the scars usually look really good initially. At 3 months, they look bad. They get worse up to about 9 months. And then, they start to get better. And there's things that we do to try to help that. But, the American way is not patient, to have patience for anything. So even though they hear us ahead of time, and I say the same thing, and that's what folks will say, you didn't tell me that. I'm like, no, I told you that because I tell every single person the same thing. They forget. And again, they don't think it's going to happen. I could tell you, listen, you're going to have a bad scar and it's going to take a year and a half. And 50% of the people have that, they don't see themselves as being that chance of them being that 50%, you know. And it's kind of anecdotally too. I remember when I used to do trauma surgery, we'd have people come in like with ruptured aneurysms and stuff. And you literally tell these families and the patients, it was sad, that we'll try to operate, but your survival rate is 50%. Or, in some of these bad cases that are dissecting and ruptured. And, they would look at you and say, well, so I'm going to be okay. And I'm like, yeah, I mean, yes, hopefully, but that 50% is not a great odds, in your favor. But we just don't see it when it's us that something's going to happen. The other thing that we deal with that's interesting, and I always, when you mentioned frustration, they'll come in and tell me like what their sister said or what their aunt said or somebody that had one, they know somebody. They'll say,
well, the internet said.
Right. Well, the internet's a whole nother story, but, but they'll come in and say, my aunt said this wasn't right and she had surgery and she didn't have this. And I'm like, well, so your sample size is an N of 1, which I'm sure it's not the exact same thing that we're talking about. She's not the exact same person. It's frustrating. We try to prevent that. I think patient preparation and sort of hopefully books and things like podcasts, listening to the right sources will give you a more realistic expectation. If you're going to somebody and they're telling you you're going to be great, you're going to get the best result, don't have anything to worry about, 100% going to be perfect, that's not good and not likely.
All right, let's end on a bright note. So, of the hundreds of people you see each week, you do some amazing surgery. You change people's lives, literally. Do you recognize that? Are you aware, or are you just so busy of just like, here's another one, here's another one, or are you able to step back after like an amazing procedure, like, I did a good job there? I mean, are you that self-aware, or are you just so busy in what you do that you don't realize the impact you have on these folks?
Well, I don't think it's because we're so busy. I think that, you can have 99 great outcomes and it's the one upset bad outcome that bothers you. And I think the things that, really weigh on me, and I know a lot of my colleagues, is the things that you lay in bed at night and worry about or think about are those things where people are not happy. And they at times will kind of make it a personal thing. Like, somehow we didn't deliver what they wanted. And, that can be a factor of how they heal, genetics. It can be a factor that has to do with expectations, and maybe we didn't set those expectations properly. Or sometimes it can just be people don't understand. And when something doesn't go right, they want to blame somebody. So, I wish we took as much joy in the good outcomes as we do, the bad outcomes. Unfortunately, that's usually not the case, because it's the things that weigh on you, and you try to figure out ways to make it better or to make people happy. And, you hear criticisms about things, and none of us are doing anything to anyone on purpose. And, they'll say, oh, plastic surgeons, they only care about money. They only care about this and businesses and stuff. Well, it's kind of counterintuitive. If that's the case, especially, then we only want people to be happy. The idea that, somebody being unhappy is some way, what we wanted is kind of, not true at all. So those are the things that you worry about. I think with time and hopefully, experience and maturity, you learn that unfortunately you can't change that with everyone. And you try to look at the other, for every person that's unhappy, the dozens and dozens of people that are extremely. But it's like anything, you don't hear from the people who necessarily are always ecstatic and happy. And so we do appreciate when folks will say that, or when you hear secondhand and you're like, I didn't know if that person was really happy, but to hear that is really, important. And I think, for young doctors and surgeons, I think, I had an athletic director in college who always said, never too high, never too low. You're sort of as good as your last outing when I played college sports. And, I think but it's a hard thing for people that are, trying to do the best they can. You almost feel, weak in saying, oh, I'm happy because they're happy. I'm more worried about the people that are unhappy.
Do you still impress yourself with some of your work to be like, man, Dennis, I did a good job on that one? Because you do so many of them. So I guess, a lot of times they're all very similar. But have you had cases even recently like, man, I'm pretty good at this? Do you ever catch yourself doing that?
Well, I think you evolve over time. I mean, there are definitely things that I do today that I feel have much better outcomes than they did 5 years ago or 10 years ago. I think there is definitely a curve with anything, that, you do get better. And the only way you know how to get better is kind of evaluating and seeing the outcome. So the thing with surgery is you can do a good surgery and it looks good at the moment, but what it looks like 3 months, a year and a half later is really the final judgment of it. And you can't get that without time. And I think that's, you do learn over time. You learn you learn what not to do as well. There are a lot of things that, I did because someone else told me or I watched somebody else do it. And now reflecting back on that, I wouldn't do that today. So I think, it's a fine line with anything. Experience is really important. And at some point, you get better at stuff just by number of at-bats, right? Like you do it and you see better outcomes because of it. But I think, again, it's funny, but each time you just want somebody to be happy and you want the outcome to be good. And so when that happens, it's not that you're ecstatic, it's almost relief. And so I think that's probably what keeps people, motivated in doing it. And that's what I enjoy doing it. I come to work to do procedures to try to make people happy, and I enjoy doing them. And I do think with time they've gotten better. And hopefully, with technology and continued experience, they only get better and better with time.
Awesome. His name is Dr. Dennis Schimpf. He is the author of Finding the New You. Doc, thanks so much for the time. I really appreciate it.
Joe, thank you. It was great talking with you.
And that'll do it for another episode of the Forbes Books Podcast. Don't forget to hit subscribe. That way you'll get new episodes as soon as they're available. And if you have a spare moment, I would greatly appreciate it if you could leave a review, which would help other exceptional entrepreneurs like you discover the show. You can always connect with me on X, LinkedIn, and Instagram at Joe Pardavila or TikTok at JPardavila. And please don't forget the golden rule and treat others as you want to be treated. Thanks for listening. Until next time, adios.